Hey guys, welcome back to Medical Coding with Blue. Today's topic is going to be all about study tips for medical coders and for medical coding students, okay? But first, I want to discuss my contact information. So, down in the description box below, there is my email, there is my Instagram page, and there is my Patreon page. Now, Patreon, if you don't know, is a lot like YouTube, but you give pledges every month to support the person who's doing the shows. And so that would be me. And different creators use it for different reasons. I particularly use my funds for different tests that I'm going to be taking. I use them for books. I use them for just different things related to the channel. So a lot of what I talk about on Patreon, or all the topics I talk about on Patreon, I do not talk about on YouTube. So those episodes are exclusive to Patreon, and it's a little bit more candid me, okay? So I do share more of myself on that channel because this channel, Medical Coding with Blue, is all about medical coding. If you guys have any questions, or if you want to share your personal story with me and you message me, that's great. You can also comment below on any of my videos. If you've noticed, or maybe you've noticed, if you've commented before, I do have a pretty quick response time to the comments. And I mean, if you're asking me a question, you're asking me a question, so I will answer. The reason that I bring this up, though, is because I did have an incident over the weekend that was not cool. Somebody reached out to me on my personal Facebook page. Now, my personal Facebook page has been since locked down. And I did have another one. I'm going to have to delete that other one. But the thing is, my personal YouTube page is my personal YouTube. My personal Facebook page is my personal Facebook page. That is my private life. And I do ask that my privacy be respected. And only contact me through the channels that I've listed below, because of the simple fact that this is about medical coding. And I do have a life outside of my channel, of course, but YouTube is starting to become a bigger part of my life. And so I guess I'm just trying to hold on to a little bit more of my privacy as well as I can. And of course, this is a digital age, so I get it. But again, I've always been very responsive to emails and things like that, unless they're inappropriate emails, which does happen, but that is not the point. The point is, if you have questions about medical coding, I will answer them right away, because that is the reason that I have this channel. This channel is not to do other things other than medical coding. And so for Patreon, I do talk about my personal life a little bit more. I do open up a little bit more on Patreon. It is a little bit more relaxed because that is a smaller group of people, and they're paying to be there. And so I really appreciate it. And I feel like it's okay to share a little bit more of my life with them, okay? And I do share a lot of my life with you guys as well. But if you want more, it's going to be on Patreon, So, but yeah, that's just what I wanted to talk about first part. Like I said, I never want to discourage people from emailing me or contacting me. But please stick with the approved channels to contact me. So that's all I ask. All right, so let's get into the tips. Now, these tips are going to also come along with stories, because I think it's important for you guys to see the benefits of when you're studying, or when you're learning things differently, and how it can benefit you, how it can benefit everything else that you're doing. You could start out with the most basic thing. Now, if this is good if you are a student, or if you are a medical coder already and you have a question and you don't have anybody else around to ask, go to Google. Go to the internet search engine, whatever one you use, and type in your exact question. Now, I had a viewer who asked about a foot ulcer and diabetes, and what documentation had to be there in order for this foot ulcer and diabetes and did they have to be coded separately, or were they going to be coded together? And I simply asked Google, how do you correlate in medical coding? Does a foot ulcer and diabetes have to be correlated together, or something like that? I put it to those effects, and it gave me the answer. It said it gives a really good reference. So I was like, okay, here you go, and I gave it to her. And so the thing is, you really do need to learn how to ask questions, okay? Now, if the question that you're asking, you can't quite think of how to word it, just start small, whatever topic it is, okay? If it is for COPD, and you want to know if COPD, what is the difference between COPD and asthma, you can ask Google, what is the difference between COPD and asthma? And it will tell you that COPD is part of asthma. Is part of asthma, is part of emphysema. Okay, so that's the thing that it's going to be telling you. So then you can start to learn things from there. So that is all about learning how to ask the question, okay? But again, going back to those plain, simple, straightforward websites, like the American Lung Association was a good place for me to start when I started in the pulmonary clinic. That was a very good place for me to start. Orthoinfo.org. Again, it was another good place to supplement my learning for orthopedic coding. I am always trying to learn. With ortho, especially when it comes to the bones, when it comes to the disease process, and when it comes to injuries, I am always trying to learn. And it doesn't matter if you're a student, or it doesn't matter if you're already a coder. You can always go back to the basics, which is learning different websites and asking Google. If you cannot get to your answer, if you cannot get to whatever topic it is, then you can ask the question on Google and see what Google comes out with, or the other search engine that you use. I did have, in the ortho clinic, we last year started using the Mako device. Now, Mako, if you don't know, Mako is a wonderful device that it is for joint replacements, okay? So it's used to assist with joint replacements, okay? Now, when they were telling me about this, they were describing it to me, they were all very excited, and they kept saying that it's a robot. Robot, robot, robot. That's all I heard was robot. Now, I don't do the surgery coding at the hospital. I used to do it until they moved me to another place because that place really needed me. But I can do surgery coding, okay? Now, I do the outpatient setting. That is what I do. So we have outpatient, and we have prophy coders, and we have the surgery coders, same day surgery coders. So this Mako fell under the prophy coders, okay? Because these patients were inpatient, so these surgeries had to be coded by the prophy coders. Well, when they were saying, what is the code? Because the surgeons were asking, well, surgeons really didn't ask, but it was the topic of discussion, like, what code are they going to use? So I had started already looking up the code, trying to see what code it was. Well, the codes that I was getting through the encoder and through the book under robot were not making sense, because when I was reading the definition of that code, again, it didn't make sense. And I'm like, this doesn't marry up with what they're saying. I said, let me see what the internet has to say. So I went to Google and I said, Mako. There was an article that popped up, and it was written by a surgeon. And he was talking about it, he was describing it, and then he gave the CPT code. I was like, there you go. So I looked up that particular CPT code that he had, and sure enough, there it was. And it made perfect sense, because it wasn't a robot, even though, yes, it is partly robot, it is computer assisted. So that leads you to a completely different code. And so I was just like, well, isn't that interesting? So I took the code to the surgeons, and they were very happy because they know I have their back. Now, I went above and beyond this day, like I always do, okay? Let's just be honest, okay? I do. I go above and beyond for my guys, okay, and girls. But I go above and beyond for them because the thing is, I need them to know that I have their back. Now, they always put the CPT codes that they use for the surgeries um, in their notes because it's just for more complete documentation. But because they didn't know on this one, I did get the code for them, and they were able to put it in. And I did talk to the profi coders about this new device that was being used in the clinic, or not in the clinic, but in the OR. And they were like, "Wow, we wouldn't have known that." And so it was just like, okay, so it all works well. And bonus, the surgeons even know even further that I am willing to help them, because could I have said that's not my lane, whatever, I'll let the other coders handle it? Sure, I could have. But I also knew, because of what they said, when I gave them the code, both of them said they would have never have picked up that code. They would have never have gotten that on their own. So it's not that they didn't care or they didn't know. The thing is, every medical coder's journey is different. Some of us went to college. Some of us went to trade school. Some of us went and learned online. Some of us had work experience previously, studied, and then took the exam. So everybody's road to being a medical coder is going to be different. There's not one set route on how to do it. So the caliber of every coder, and I always say it all the time, the caliber of every coder is going to be different. So, and then if you want to study more, and a lot of times coders can be guilty of stopping studying. Once they get their certification, they're done. They're in their clinic. They know what to do. And they're reporting the same thing all the time. And they're just sort of going through the documentation really quickly and not really digging and finding out if there's anything missing, or if there's anything that they need to pick up, or if there's anything, I'm sure they're looking over it, but the digging part isn't there. Trying to look and trying to advocate for either this or that, or whatever the case may be. You have to learn to look. And even though the provider may tell you, this is what I want you to report, if the documentation is not there, guess what? It didn't happen. And that is something that if you are a student, you're going to learn that really quick. If it's not documented, it didn't happen. And for us veteran coders, oh yes, y'all know what I'm saying. Y'all know. And it's just one of those things. You have to make sure that you are really digging in there for your providers. And part of doing that is studying and making sure that you are looking at these other resources. Now, if you're new to my channel, and if you've been to my channel before and you've heard me, I do read the New England Journal of Medicine. Now, why? Because it's got everything in there, and it's got perspectives from doctors, and it's got their point of view. And you will hear sometimes that, especially when it comes to communicating with the providers. Now, providers, they speak one way, okay? Now, there are some medical coders out there in the world that are actually doctors. They've actually gone through a certification program, whatever, and they've gotten their certification, and they are a doctor as well. And I love those people because they get it, and they're doctors and they get it. And so if a doctor is also a medical coder, they can speak to other doctors because they have that doctor speak. Now, to get a relationship good enough to communicate with a doctor, and you're a medical coder. Now, a lot of times us medical coders, we either have a high school diploma or a GED and our certification, and that's it. We didn't go to medical school. So sometimes when you're talking with these doctors, with these surgeons, they're going to look at you, especially if you're not prepared. This is why I always stress preparedness. If you are not prepared, they are going to look at you, and sometimes they will even tell you, I don't have to listen to you. You're not my boss. You don't tell me what to do. It's not that you're trying to tell them what to do. It's that you should already have that energy of, I want to be a partner with you. I want to work together so that I can make sure that you are adequately and appropriately compensated for what you're doing. Because so many times before I've been guilty of not talking to my providers before because I was scared of them. I mean, honestly, I was. And again, if you've watched my videos, you've heard me talk about Dr. X before. Dr. X was very instrumental in helping me to start talking to providers. And he said it himself too, that doctors speak doctor and coders speak coder. He goes, for whatever reason, me and him are able to communicate well. I mean, for him being a doctor and a surgeon at that, and me being a medical coder, the fact that we can communicate is really huge. So a lot of times what he does is he translates. I will literally say something in a room, and he will literally translate what I just said. And then you see the light bulb go on. But, now that everybody knows me, and now that I'm more confident, obviously, this is not something that happens a lot. We are almost never in a class together anymore. I think the last time we were in a class together was a couple years ago. And for whatever reason, he always misses my classes. And so, when you, the reason that this communication goes so well is because he did see that I would come to him with a book. I would bring my resources and I would tell him, sir, I see this, and I see this, and I see this. And then your documentation says this, this, and this. Can you help me to marry the two? Because this doesn't make sense to me. So then he'll say, it's this, this, and this. And I'm like, oh, okay, now I get it. So it is all a matter of building that trust and building that support with each other, okay? But it comes from you showing your part and going and looking at your different resources, whether it's the Merck Manual. I do have it in my Instagram. I do have a picture of the Merck Manual. The Merck Manual, your coding companions, which are made by Optin360. And this is not an ad, but Optin360, call me. Optin360 is a wonderful website with so many supplemental books that are so amazing. I can't get over them. I know I always talk about them, and they're not paying me. Okay, I'm just saying. But I still brag about them anyway, because these books, coding companions, are broken down by different specialties. Now, you can go to optin360coding.com, and they have tons of books all the time about different specialties. So if you are a veteran coder already, or if you're a new coder, or if you are studying and you want to learn more, they do have the previous year books that you can get for a cheaper rate. They have tons of sales all the time. But these books break down like all of the CPT codes. They break down the diagnoses that go with them. So like they have like a whole list of diagnoses that can go with these CPT codes. And it'll give you RVUs, the relative value units, basically what the doctor is getting paid for these. And, it's not broken down by dollar amount, but RVUs are the weight of that procedure, okay? Every procedure that they do is weighted, okay? And they use this RVU generation, these numbers, to find out what the doctors are generating. If they're making, a certain amount, or if they're meeting their goals or MGMA goals. There's a lot of things that they do with this data. So there's that, there's the definitions, there's so many different things. All of this information is housed in these coding companions, which is amazing. So I always recommend those. I recommend the coder desk reference for procedures. If you are doing outpatient procedural coding, they have a lot of good information in those. Okay, they have the coder desk reference for diagnoses as well. And all of your diagnoses are broken down. They will give you the layman's definition of all of these codes. So these little things are really helpful once you start getting into the nitty gritty of it. And a lot of times, as coders, sometimes we get very tired of having to study. But when you start looking up these things and you start having to dig and look, and then all of a sudden your codes go from being, to to being more specific, because now you really understand what you're reading. Now you really understand the codes and relations to each other. It is amazing. This is why I always get excited. You guys see me. I get so excited when I start talking about this stuff, because it does a lot. It does a lot for the provider. It does a lot for the facility. It does a lot for the patient, because not only is a patient paying accordingly, like whatever they're supposed to pay the provider, right? It's also going for more detailed procedures and diagnoses that were performed. And so when they take those records and they go see somebody else, they know exactly what's going on if they're looking at all the diagnoses and everything that is being reported. So this is why it's very important to make sure that you stay on top of those details, and studying and continuing to look at those kinds of websites like orthoinfo.org or the New England Journal of Medicine, nejm.org. That's another one that I personally love. And if you sign up on nejm.org, they do, if you do the website sign up, they let you have access to a couple of free articles per month, okay? And then, you can just read, whatever they have there. And it's very interesting. They have a lot of good deals when it comes to, if you want to do the yearly subscription. Sometimes they have the new subscriber rate, So if you're interested, you should check it out. I subscribe to them. I get the journals all the time. And I mean, I like reading them. Some of that stuff, I'm telling y'all though, it goes over my head, but it's okay, because I don't let that scare me into not reading it anyway, because eventually it's going to make sense. And I can't tell you how many times I've read those books or the magazine, and then I've been listening to the surgeons talk, and I'm like, I know what you're talking about, because I do. Now it makes sense. Now that I hear that, and then I read the book, the magazine. So I'm telling you guys. And if you haven't had a chance to check out Dr. Lynn's video, I posted 2 of them in the community tab. He is a urologist. Amazing. And he talks about this device, okay? And he's showing it in the video. And this device is really amazing. So if you are a urology coder, make sure that you check it out, because even though, like, of course you're not using it, but it does help to understand, like, what does it mean when they say a French tip? What does it mean when they say this? Or what does it mean when they say that? Watching those videos is going to really help. That's why I share those videos. So I hope you check out Dr. Lynn's channel. I will leave the link down in the description box as well. So that way you can check it out and see the different things that he talks about on his channel. Again, exposing your mind and your brain to different specialties. And if that's your specialty, hey, that's great, because then that's just more detail that you can just listen to. And it does help you to study. It helps you become sharper. Okay, so I'm going to go ahead and wrap this one up. But yes, that's my tips for today. Just going to the different websites, typing in the actual question into the search engine, and that may help you or lead you in a right path. Okay, so just my advice for today. So I'm going to go ahead and wrap this one up. But I hope if you've liked this, if this video has helped you, please give it a thumbs up. Comment below, because this helps me with the YouTube algorithm. And the more I can share my videos, the more broader reach I get for my audience, the better. Because you don't know what sharing my videos can do for other medical coders, okay? So maybe they have a question, and maybe one of my videos can help them. At least that's always the hope. So I'm going to go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!